Eating disorders are complex mental illnesses that affect the individual biologically, psychologically, cognitively, and socially. The most common eating disorders are anorexia, bulimia, and binge eating. Adolescence is usually the time when eating disorders first appear, but they can occur throughout the lifespan. Research has shown that families play an important role in the maintenance but also the recovery of eating disorders. It has been suggested that there are also family factors, particularly having to do with parents, that may predispose an individual to developing an eating disorder. In addition, traits of anxiety are commonly seen in those who have an eating disorder. Examining the family factors and the role of anxiety, as they may together put one at a greater risk of developing an eating disorder, is the focus of this video. The caregiver relationship impacts multiple areas of development, including eating-related thoughts and behaviors. Several studies have shown that there is a relationship between insecure attachment and eating disorders. This link may be due to the role of attachment on emotion regulation. Individuals who are insecurely attached develop maladaptive strategies for regulating emotion. If maladaptive strategies for dealing with emotional distress are continually used, it is possible that disturbed eating behavior and attitudes will manifest as methods of coping. Other research has shown that when dealing with emotional distress, those with insecure attachment may misinterpret emotional distress as bodily distress. The perceived bodily distress may then be relieved by excessive preoccupation with appearance, eating, or exercise. The temperament or emotional state of parents does have an effect on the psychopathology and eating disorder characteristics in their children. Generally, as anxiety and depression levels in the parents increase, so does the level of psychopathology and eating disorder symptoms in their children. This effect is more likely if the child struggles with regulating his or her emotions, which may manifest itself as an eating disorder. The severity of psychopathology in parents does not seem to affect which type of eating disorder the child develops, nor the severity of the eating disorder, but may affect the severity of other disorders such as anxiety and depression. Current findings show that adolescents who suffer from eating disorders have also experienced some form of abuse earlier in life. About 30% of all eating disorder cases report history of childhood abuse. To better understand the effects of child abuse, how it relates to eating disorders, and how eating disorders can be treated, Zhang and her colleagues analyzed a group of adolescents who suffered from emotional or physical abuse. The patients were tested at baseline before starting psychodynamic therapy and 12 months later after the completion of therapy. The improvement of eating disorder symptoms was much less evident compared to the control group. Although family can negatively impact the development of eating disorders, including family in the treatment process has proven to be highly effective in treating eating disorders in adolescents. These findings highlight the importance of the role parents play in eating-related thoughts and behaviors, whether direct or indirect.